Hello friends, my name is Dr. Meghna Chopra. I'm an endodontist practicing in Mumbai. I hope you all are fine and safe. We all have been confined to our homes for the past 2 months due to this COVID-19 pandemic. I have realized after all the turmoil that this COVID-19 is not going away any sooner. It would take months to years for this to go away, and we need to learn to live with it like HIV, TB, etc. We need to acclimatize with this. As we know that during the lockdown, we all are only performing our emergency treatments without aerosol. But after some time, once the lockdown is lifted, we need to go on to our routine dental practice. So in addition to the guidelines which have been given by the DCI, IDA, IES and the other government bodies, we need to follow certain other guidelines also while doing endodontic procedures for our safety as well as our patient's safety in order to prevent the transmission of the disease. These changes have to be made permanently into our routine dental practice. So coming down to them, the first important step would be a pre-procedural mouth rinse of 0.2% povidone iodine for 1 minute, which can be given to the patient in order to reduce the viral load and the bacterial load as well. Rubber dam is also going to be very mandatory in order to reduce the aerosol. We have to upgrade our practices. Friends, if you haven't used the rubber dam, please try to learn it and incorporate it into your routine dental practice, as it will help to reduce the aerosol. Use of high wax suction is also very important in reducing the aerosol load. Coming down to our endodontic files and burrs and the other instruments which we use for our endodontic practice, they have to be thoroughly cleaned after use using sodium hypochlorite solution, 5.25% sodium hypochlorite solution for about 5 minutes. We need to keep our burrs and the rotary files, followed by the ultrasonic cleaning, and the autoclave is very important. Then coming down to our RVG, when we could use 2 sleeves instead of using 1, so that after we have taken the radiograph, the patient can remove 1 sleeve. After that, we can remove the other and use an alcohol scrub to clean it. If friends, you are having a multi-chair clinic, then 1 chair we can dedicate it to aerosol procedures and the other chair only for consultation and non-aerosol procedures. And also to keep the water spray in the aerator to a minimum setting, or instead of that we can opt for micromotors with intermittent water spray or electric motors as well. And the dental water lines we need to flush with 0.01% sodium hypochlorite solution. Thank you friends for your patient listening. I hope this helps, and we shall all rise like a phoenix from the dust after this COVID-19 pandemic.